sixth cranial nerve. So if we are talking about the sixth cranial nerve, so this is from here, around it you will see that there was the branchiomotor branch. This was the branchiomotor branch. I am not changing the color so that it becomes easier for you to understand. So this will go here like this, and this is going to create facial colliculus. You remember here it was a little bit elevated and it was called as the facial colliculus. Last class we discussed that there is a kind of elevation here. Here there is a kind of elevation and it is called as facial colliculus. So, and this is that, finally this is the branchiomotor nerve. And what we learnt here is that this entire nerve, and then there was other two. So which one were the other two? So we also learned that there was nucleus of tractus solitarius. This was nucleus of tractus solitarius, and this gave the nerve like this. And then we also learned that there was the superior salivatory nucleus, the superior salivatory nucleus, and this superior salivatory nucleus was also given this one. And then we learned that this entire thing formed like a entire tubing like this, a single nerve like this, and that nerve was called as nervus intermedius. Now, and then nervus intermedius, correct. Now what we learned that, like today we learned that this is going to enter into the internal auditory meatus. So if I have to consider that if this is suppose the brain stem which is present, so then I also need to consider that there is supposed to be, like suppose this is foramen ovale. Okay, try to understand. I am taking a section of the skull so that I can see the brain stem. So brain stem will continue to form spinal cord. That means this is the aperture through which spinal cord is coming out. So which aperture is this? Foramen magnum, present in the occipital bone. You remember this is the foramen magnum of the occipital bone. So this is that foramen magnum. Now if this is foramen magnum which is coming out from here, then I can say that if you correlate just in front of foramen magnum there is internal auditory meatus. If you look at the above picture of the skull, then you will see that just in front of foramen magnum there is internal auditory meatus. So suppose I am going to show the internal auditory meatus like this. So this is going to be the floor of the skull, and this is the internal auditory meatus, and this internal auditory meatus is going to form, or is going to enter into the middle ear. Okay, this internal auditory meatus is going to enter the middle ear. So this entire canal is known as the internal auditory meatus. This is, I can write it here, internal auditory meatus, IAM. Now if you remember middle ear, okay, so let's talk about middle ear a little bit. So how does middle ear look like, or how does it work? So suppose, to show you, I cut the walls in a way so that it becomes easier for you to understand. So let's say there are some walls present in this middle ear. So I am showing you, say this is one wall like this. So then there is going to be the other wall of the middle ear like this, and like so you understand that the back side towards the brain stem, this wall which I am right now drawing, this is going to be the posterior wall, and what I am doing is I am cutting the anterior wall a little bit. So that we can see what is happening inside. So if you look at what is happening inside, you will see that inside the medial wall, in the medial wall, there is present a tunnel like this. There is a tunnel present over there like this. And this tunnel is going to go down. Okay, or I can show it like this. So this is a solid tunnel in the bone, in the wall of the middle ear only, in the medial wall of the middle ear, and this is going to go down, and it is going to open up here, and this will be called as the stylomastoid foramen. Okay, so do you know what is stylomastoid foramen? Stylomastoid foramen? No?
Yes, sir.
Okay. Now, Podechi is fine, but do you remember?
Yes, sir.
Okay. So, if you know, it is a foramen which is present between the styloid process and the mastoid process. So that means if this is stylomastoid foramen, so can I say that means here this is going to be the mastoid bone of the temporal bone, mastoid part of the mastoid process of the temporal bone, and I can also say that this is going to be the styloid process, because that's the position of stylomastoid foramen. That stylomastoid foramen should be present in between the mastoid process and the styloid bone. So if that is true, then this is supposed to be the styloid bone, and this is going to be the mastoid. This is mastoid and this is styloid. Why is mastoid called mastoid? Do you know?
Related to mastication.
Mastoid bone of temporal bone, I mean mastoid process of temporal bone is related to mastication. How? Acha. What is the meaning of the word masto? Have you heard of the word masto before? Yes or no? Mane, meaning? Meaning? Acha. Have you heard of the term mastectomy? Complete mastectomy, hemimastectomy. Have you heard of this word? What is it? Do you know? Idea?
Sir, cutting of muscle.
Muscle? No. Mastectomy means whenever we said tummy comes from the word tomos. So what do you mean by the word tummy? Tummy means
Cutting.
to cut. Yes. So tummy means cutting, and masto means breast. So suppose somebody has developed a breast cancer, and suppose a half of the breast has to be cut and removed. So we use the word mastectomy. Masto means breast. Understood? So earlier, when the doctors observed this process of the temporal bone, it is a smooth, rounded part of the temporal bone. So this smooth, rounded part of the temporal bone, they thought that it is looking like that of the breast, because breast is also rounded and smooth. So this part, since has a masto-like appearance, breast-like appearance, hence it is called as mastoid process. Okay. You will see that there are some mobile phones, high-end mobile phones, along with which there are some very sleek sticks come up with which you can write. Do you know what is it called? Those sticks, what are they called? Do you know? With which you can write on mobile phone, you can write on laptop, you can write on computer. What is that? We don't call it pen, right? We call it something else. So what do we call it? Do you know?
No, sir.
Stylus. It is called a stylus. Okay. Stylus. Never heard? Stylus?
Yes, sir.
Acha. So it is called stylus. Now if you look at this process here, the Boni process, don't you think it is looking like that? Very sleek, pointed, like pen, like a stylus. So if masto-like structure is mastoid, so stylo-like structure should be styloid. Simple. Okay, and in between them lies the stylomastoid foramen. So from where is the stylomastoid foramen coming? Through the posterior wall, or through the medial wall, or through the lateral wall, or through the frontal wall?
Sir, medial wall, then posterior wall.
Very good. So it is medial wall, then the posterior wall, and then it is going downward. From this picture it is clear? Then it is fine. Acha. So now if these structures are clear, now let's see. So we see that this branchiomotor nucleus, it enters over here, and along with that, and okay, it enters over here and it curves backward. Okay, now this is the tricky part, that you should know that this facial nerve, it is curving so many times. In the beginning only it curved around 6th cranial nerve, that is the abducens nerve, and created a facial colliculus. But and now once again it is, see, it is turning back like this. Once again it is turning backward. And so what is this entire canal called as? This entire canal through which the facial nerve is passing, this is called as facial canal. Okay, so we can say that the facial canal is beginning. If somebody asks you the anatomical location of facial canal, what will you say? It begins at the antero-superior corner. Can I say this? Try to find out. Antero-superior corner. Right. So these branchiomotor fibers, they are going to just pass like this. They are going to just pass like this, and they are going to move towards the posterior wall, and then move downward, and then it is going to open out through the stylomastoid foramen. Okay. Yes, yes, correct. Now remember that here there is another thing that you should know. What is it? Now inside this facial canal, where it bends, here lies a very, very special ganglion. Okay, here lies a very, very special ganglion, and this ganglion, where it bends, you can see it, right? Where it is bending. This ganglion is called as geniculate ganglion. Okay, I hope you have heard it sometimes. It is called as geniculate ganglion. Okay, so there lies geniculate ganglion. What do you mean by the word genu? Are you aware of the word genu? If you look at corpus callosum in your brain, if you have studied neuroanatomy, it has got two parts. The anterior part is called as genu, and the posterior part is called as splenium. So this genu word, what is the meaning of the word genu? Are you aware of that? Genu means bend. So this ganglion is located where? It is located at the bend area. So that is why it is called as geniculate ganglion. Okay. Yes. Hence it is known as geniculate ganglion. Clear? Now, so what is this story with the geniculate ganglion? So remember, geniculate ganglion is a sensory ganglion. Remember, geniculate ganglion. Now many people get confused over here. So that is why I'm making it aware from earlier time that geniculate ganglion is a sensory ganglion of facial nerve. It is not a motor ganglion, mind it. It is a sensory ganglion and only a sensory ganglion. Okay. Now you remember that along with this branchiomotor neuron, there was those nervous intermediates was also coming, na, which was having the lacrimetry and the salivatory nucleus. So if you if you remember that there was something called as a superior salivatory nucleus which was present. There were three nuclei, na? So there was superior salivatory nucleus, and branchiomotor is what? It is motor, main motor nucleus. So motor is going down through the stylomastoid foramen. If you have a tendency to forget, let me write over here stylomastoid foramen. So is this stylomastoid foramen, and then salivatory nucleus which is present, that is for both lacrimation and salivation. Last class we discussed it that salivatory nucleus will lacrimate as well as salivate. So it will work on submandibular as well as sublingual. Okay. And I also told you that this is superior salivatory nucleus, not inferior, because inferior salivatory nucleus is associated with glossopharyngeal nerve. Glossopharyngeal is the 9th cranial nerve. Okay, so we are talking, and then there was nucleus of tractus solitarius, which is again sensory in nature. But anyway, and it was having gustatory fiber, etc., etc. So right now I am not bothered with that. We will come back to that later on. For the time being, we understand this, that the lacrimetry nucleus and the salivatory the fibers, the lacrimetry and the salivatory fibers. So they were also coming like this. I'm not changing the color so that you don't confuse. So it enters into the ganglion, and from geniculate ganglion, lacrimetry and salivatory fibers of facial nerve will leave. And when they will leave, we will call it as greater petrosal nerve. Okay, have you heard of this word, greater petrosal nerve? Yes. So what is greater petrosal nerve? If you look at the color coding, I'm not changing the colors so that you understand. So if you look at this, then it is the lacrimetry and the salivatory fibers of facial nerve will leave as greater petrosal nerve, and so they enter into the floor of the skull. And immediately afterwards they will enter. Now if you once again, I will just drag it up once again. If you look at the cranial fossa, you will notice that just a little above this internal auditory meatus, just a little anterior to the internal auditory meatus, there lies foramen lacerum. So it will just move out as greater petrosal nerve, and then so I'm just going to write it as greater petrosal GP, greater petrosal nerve, and then it is going to again enter into the foramen lacerum. Tell me, is that understandable or not understandable? Okay, so yes, so it is going to enter into foramen lacerum. Now let us understand. Yes, foramen lacerum, it's lacerated. Now let us see how is foramen lacerum looking like. So foramen lacerum has a canal like this. Oh, I've changed the color, sorry. Let me get back to our proper color coding. Okay. So this is the foramen lacerum, the inner part and the outer part. And if you look at your above picture of cranial fossa, then you will notice that this is foramen lacerum, and then it will go a little bit forward and you will see foramen rotundum is also present. And then superior orbital fissure will be present. and then orbit will come up. If you look at the above picture of cranial fossa and imagine that I have chopped it off, so you will see that there is this foramen rotundum, superior orbital fissure, and all these things will be present. And then here you will see maybe lacrimal gland, because this is the orbit area. Is it understandable? So as we understand that this canal, okay, this foramen lacerum, it enters through this foramen lacerum, and it doesn't come out. This nerve doesn't come out of the skull. This will enter and this will progress. This will proceed forward through this bony canal. So you see, now we are talking about two bony canals. One was a facial canal, and now we have seen that there is one more canal. And at this point of time, I would also like to mention here that do you remember that here there will be present something called as there's a bony prominence like this. Do you remember this thing? That here there was the maxilla and it was creating a pterygopalatine fossa. And we discussed it that initially, if you remember, I don't know, the trigeminal discussion, I told you that here there will be a cleft like structure which will continue to form a tunnel like structure, and then it is going to end up like this. If you can imagine the lower eyelid, the nose, the upper lip. See, is it understandable or not? Is it okay for you to understand? And this was the pterygoid plate. Tell.
লাস্টের ড্রয়িংটা তো আরেকবার দেখাবেন, কারণ দেখানোর সময় না হেল্প হয়েছিল আমার কাছে নেটওয়ার্কের জন্য, মানে এটা পর্যন্ত ক্লিয়ার বুঝতে পেরেছি।
This diagram you have already seen in trigeminal nerve discussion. So my question is, do you remember this?
Yes, sir.
Bas, that's it. Okay. Now what we will see, that here inside this area there is present one more nearby area, there is present one more structure, and that is the internal carotid artery. So do you know that there is present something called as internal carotid artery? So here somewhere in this region there will be present internal carotid artery. Now if you have studied internal carotid artery or anatomy around that region, you will know that around internal carotid artery there is present post-ganglionic sympathetic fibers. There, around the internal carotid artery there are present some ganglion. I don't know whether you have studied this or not ever, but around this there is present some ganglion. Okay. Now from this ganglion, if a nerve comes out, so it will be presynaptic or postsynaptic, or preganglionic or postganglionic. What do you think? If there is a nerve which comes out from here, so this nerve should be preganglionic, postganglionic. Very good. And the ganglia which are associated with the internal carotid artery, it is sympathetic or parasympathetic? It is sympathetic. Yes, that means this green colored nerve that I have mentioned, this is going to be postganglionic sympathetic fiber, and it is going to approach the greater petrosal nerve. So as the greater petrosal nerve is moving, even this nerve is moving, and now this nerve should have a name. What is the name of this nerve? Deep petrosal nerve. Okay, so This is greater petrosal. So this is greater petrosal nerve which is moving, and this one is the deep petrosal nerve. Deep petrosal which is moving, and inside this foramen lacerum, and together we give them another name. There is another name to it. So together, what do we call it? So together, this thing, it is called as Vidian nerve. Vidian. Together, it is called as Vidian nerve. So we can say that this Vidian nerve, in, like, I can say it in this way, that in front of the lacerum hole, like suppose this is the front of the lacerum, so in front of the lacerum there is a hole, there is this hole, there is an aperture through which this Vidian nerve will enter the pterygoid ganglion. If you remember trigeminal nerve, at that time we actually discussed this fact. I don't know how much you remember, but actually we had a discussion on this, that here there is present a pterygopalatine ganglion. This is a pterygopalatine fossa, and then here there is a pterygopalatine ganglion. So this Vidian nerve will enter the pterygopalatine ganglion. Yes. Understood? No confusion till this much? Okay. Now, if I say that there is a person who is suffering from herpetic infection of geniculate ganglion, you know, herpes sometimes attacks nerves. If you have studied the pathology, oral pathology and all, you must have read that whenever there is any herpetic infection, there is a tire track lesion. Why? It looks as if some cart or some car has actually traveled through the way. The lesion goes in line. Okay. Why does the lesion go in line? Because they always trace your nerve. Wherever the nerve is going, there their lesions are going. So that is how you get that tire track lesion. But anyway, my point is this, that when people suffer from herpetic infection of geniculate ganglion, do you realize that there will be vesicles formation? See, herpes mane, you know, herpes simplex virus?
Okay.
Yes. So what does herpes cause? Cold sore. Okay. So if there is any herpetic infection, what do we see? In herpes infection, there are blisters, vesicles formation. Yes. So now if herpetic infection attacks the geniculate ganglion, can I say that there is always a possibility that vesicles are going to form on the tympanum? So remember this, that when vesicles are going to form on the tympanic membrane in the middle ear, so we can say that the middle ear is getting filled with fluid. If there are so many vesicles, can't I say that middle ear is getting filled with fluid? And that fluid pressure can damage the facial nerve. And I haven't taught you yet, but I told you in the beginning that your facial expressions are because of facial nerve. Yes or no? So that means if there is these fluid filled vesicles, they are going to crush your nerve, then there can be paralysis of the face. Half face may be paralyzed, right ear or left ear, depending on that. Half paralysis of face will occur. It is called as hemifacial paralysis. So have you heard of something called as Ramsay-Hunt syndrome?
হ্যাঁ স্যার।
So now you understand how this disease occur, Ramsay-Hunt syndrome. Okay, so there is hemifacial paralysis due to herpetic infection of the geniculate ganglion. So that is called as Ramsay-Hunt syndrome. Can we proceed till this much you have understood?
হ্যাঁ স্যার।
All right. So now let's proceed ahead. So what we learned that even there are taste fibers from nucleus of Tractus solitarius, the blue colored nerve.
স্যার স্যার জাস্ট 1 মিনিট দিন না,
Huh?
1 মিনিট না।
Okay. Done?
হ্যাঁ স্যার বলুন।
Yeah. So okay, so you can see that like I was telling that the taste fibers from nucleus of Tractus solitarius. We should talk about that also, na? The blue colored nerve.
হ্যাঁ
The nucleus of Tractus solitarius. So remember, now the nucleus of Tractus solitarius and the salivatory fibers. Okay, are you there? Nucleus of Tractus solitarius and salivatory fibers, they jump from the facial canal and then they are going to enter the middle ear. Okay, so and not only they will enter the middle ear, they will also enter into the oral cavity. So let's see how it works, how it happens. So if you see that suppose this blue fiber is coming like this. Okay, so this blue fiber comes up like this, and even a part of the salivatory nucleus that will also come up like that.
হ্যাঁ
Right. Now both these fibers, okay, they are going to jump from this facial canal. Both of them, they will jump from the facial canal and they are going to enter inside the oral cavity. They move like this and they will try to enter into the oral cavity like this. So this one is which one? This is the your salivatory and the lacrimating fibers. Yes, lacrimal fibers, and we also have this one. So this is the nucleus of Tractus solitarius taste fibers. Yes. So taste fibers from NTS and salivatory fibers jump from facial canal, enter the middle ear, and then they jump into the oral region.
oral cavity।
Yes, oral cavity. Okay. So over here, once we have discussed this, so as this facial nerve comes out of the stylomastoid foramen. Now let's see what happens to the stylomastoid foramen. Let's complete that part. So as soon as it comes out of the stylomastoid foramen, first it is going to supply the posterior belly of digastric. Okay, there is a noise coming up from your side, but okay, chalo, now it is fine. So it will supply the posterior belly of digastric. Okay,
হ্যাঁ স্যার।
and where is this posterior belly of digastric it will get? It will get when it will go posterior and upward. So basically it has to move upward, posterior and upward. Yes, like this, backside and upside, behind the ear basically. See, this is the ear, na? If you look at it, this is the middle ear. So if this is the middle ear, then I can say that like somewhere here there is supposed to be the tympanum present.
হ্যাঁ
And if this is where tympanum is present, that means I can also say that somewhere here there will be the stapes present. And if this is where the stapes is present, then I can also tell that the tiniest muscle, smallest muscle of our body, that is called as stapedius, that is attached from here with the posterior wall. Okay, so this is the stapedius. So it is connecting to the stapes. So remember, one part also, some nerves also can supply the stapedius. Okay, so it's the one branch goes to the stapes like this. But anyway, so as soon as this we talk about the ear, so it is going to the behind the ear. So behind the ear, what is it called? As soon as it goes behind the ear, so let me show it in another way. So okay, so as soon as it is going behind the ear like this, so it is called as, it is going to the back of the ear, it is called as posterior auricular. Auricle is the part of the ear. So since it is going behind ear, so it is posterior auricular branch or posterior auricular nerve, and it is going to supply the auricularis muscle, because somewhere here there is going to be the big ear present. So ear present means there is auricularis muscle, and if this is the ear, then somewhere here this is the mastoid process. Behind this there will be occipital bone. So if you remember, here there will be fronto-occipital muscle, occipitofrontalis muscle. So this nerve this nerve means posterior auricular nerve. Posterior auricular nerve will supply auricularis muscle and the fronto-occipital muscle. Then another motor branch, because this red color or whatever it is, orange color, this is supplying this is the motor neuron. If you remember, branchiomotor, if you trace back to the brain, it is the branchiomotor. So this another motor branch is going to supply the digastric muscle, posterior belly of the digastric, and also the stylohyoid muscle. Okay, it will also supply the stylohyoid muscle. And finally it is going to jump into the parotid gland. Okay, so it is going to supply the posterior belly of digastric. Okay, I think I should put it in this way. Wait, let me show it in this way now.
আপনার স্ক্রিন শেয়ারও বন্ধ হয়ে গেছে।
Log out and then log in back, because from my okay, now you can see the screen. So you see, this is suppose the parotid gland. So as we learned that as facial nerve comes out, it goes to posterior and upward behind the ear to form posterior auricular nerve. It supplies auricularis muscle and fronto-occipital muscle, and then another motor branch is going to supply the digastric muscle and posterior belly and stylohyoid muscle, and finally jumps into the parotid gland. So let's suppose this is the parotid gland. This is the parotid gland. Now once this enters inside the substance of parotid gland, now remember it very carefully, as soon as it enters the substance of parotid gland, so it divides into 5 branches. Okay, so one branch will be called as the temporal branch. I think I will put it in this way. So one branch will be called as the temporal branch. One branch will be called as the zygomatic branch. One branch will be called as the buccal branch. One branch will be called as the marginal mandibular branch, because if you can understand this, that here there will be the mandible also coming. Yes or no? Yes. So this is going to be the marginal mandibular branch, and then there is a fifth one that is going to supply the platysma muscle, and that is going to be the cervical branch. So cervical branch will go to the platysma muscle. Okay. Now, understood this much? Now, the parasympathetic fibers from the parasympathetic ganglion, okay, sorry, not the parasympathetic ganglion, I mean the this pterygopalatine ganglion. Okay, so from the pterygopalatine ganglion, it gives off a branch to the maxillary nerve. So if you remember that the brown colored fiber which was present, this brown color, look at this, what is it called, the petrosal nerve area, the hole in the lacerum. So it is entering the pterygopalatine ganglion. So if you remember it, that this is for lacrimation and salivation, so these must go to the lacrimal gland and the submandibular gland. So parasympathetic fibers from this ganglion, they will give off a branch to the maxillary nerve, and if you remember, the maxillary nerve was also passing from here. So it will give off this branch through the maxillary nerve with its zygomatic branch, and it will pass through the inferior orbital fissure. Okay, it will pass through the inferior orbital fissure, and remember, it is not going to synapse in the pterygopalatine ganglion. Here there is no synapse, it simply passes like this. Why? Because pterygopalatine ganglion is a sympathetic ganglion. This is a parasympathetic fiber. So parasympathetic fiber has got no place in the pterygopalatine ganglion. So always remember this, it does not synapse over there, and it is going to communicate with the lacrimal nerve and go to the lacrimal glands. Okay, it is going to go to the lacrimal glands, and not only that, they will also supply the paranasal cavity, or the paranasal, sorry, not the cavity, the sinus, I mean nasal glands, as well as the palatine glands. Okay, so this is the entire distribution of facial nerve. So tell me, have you understood or not?